All right, so this is going to be a presentation on childhood onset schizophrenia. So, first things first, we have some potential causes or the etiology of this specific disorder. We have environmental factors, so adverse experiences that are going to, prevent development, proper development in these children. We have negative interactions with the family. These are, a big thing that affects children and how they develop and their brain and everything like that. And then we have prenatal and perinatal factors. So this is going to be just exposure to certain things such as malnutrition, respiratory infection, specific, illnesses such as the flu or rubella. Then we have hypoxia during birth, which is, it can happen by the umbilical cord wrapping around the baby, stuff like that. And then genetics also obviously plays a big part. Then we have some struggles with diagnosing, so it is hard for these clinicians to tell the difference between these hallucinations and then just normal play that these children are, going through, because it is pretty imaginative and it's hard to tell what could be just playing and what could be actual symptoms. And then again, these children, a lot of them have a hard time describing what they're going through in their brain and their head, and because of their language development, and that just isn't up to the point of, adults in the same way that they can describe what they're going through. And then we have misdiagnosis. So this is actually fairly common, unfortunately. There are symptoms of other disorders like bipolar, autism spectrum disorder. They can be wrongly diagnosed as, childhood onset schizophrenia. And, comorbid conditions, which is disorders that can occur at the same time within one individual, they can also be missed. Which, again, a lot of these disorders have similar symptoms, so it is very, very hard to tell the difference, especially when they occur together. So now we have symptoms. So we have positive and negative symptoms, which these are not necessarily good or bad. It's just things that are added on or taken away from a person and what they go through. So positive ones are things that are, changes in their emotions, their feelings, thoughts that are added on to what they're going through. So they're not typically there, but they are added on during this disorder. So we have hallucinations, delusions, those, I think that's one of the main symptoms. We have abnormal motor behavior, which is, their motor development, moving around. It's just not quite right. And then we have, the disorganized thinking, speech patterns, which a lot of children with this have problems with speech and language development. And then we have the negative symptoms. So these are things that are taken away from a child's experiences. So lack of affect. We have that, which is emotional expression. So, they're not able to express their emotions fully, like in their face, in their tone, stuff like that. And then we have lack of motivation. So absence of speech. This can actually occur. So they could have disorganized speech patterns or, not up to par speech, or we could have just complete absence of speech. And then we have little interest in social interaction or enjoyable activities, which that is something that, if you could tell, occurs in childhood depression as well. So these are things that, they can occur, unfortunately, in multiple different disorders. And so it is kind of hard to tell sometimes which disorder is which. And then now we move on to the treatment options for this disorder. And as this is a more difficult one, there is a multidimensional approach to this treatment. It is not a, cure-all. You take one medication and it can be pretty manageable. It's not like that at all. There is, antipsychotic medication is a big one that they try to put these children on. There's also therapies like individual, family, support groups, these skills training, especially for the speech and language, social, and CBT, cognitive behavioral therapy is a thing as well. So just anything that can help these kids and prove that they're not alone and that, other people are going through the same thing, and to get help for these families as well, having to, caregive for someone like that. And now I put in just a slide about impact on families. So again, it can be a big stress on families that are caregiving for a child with this disorder, parents, siblings, hostility, distress, the guilt, anxiety, and then again, just the levels of the burden are associated with how severe the patient's symptoms are. And now we move on to statistics. So it is present in only 1% of the population. So this is a pretty rare disorder. But then it also occurs in up to 5% of first-degree relatives. So this is going to be siblings or children, immediate family of people with schizophrenia. So it is a higher rate if you are very closely related to someone with it. And then this was just a study that I linked in the sources at the end about 117 pediatric patients where the average age was about 13. This just shows what type of hallucinations they have, because I feel like a big one is that there can be thoughts that it's just like auditory, just visual, which there all are other hallucinations as well. Tactile is touch, olfactory is smell. There is other types of hallucinations, and this just shows how many children had each type of hallucination. So this is case study. So this is a case study that we did in this class, and also it is one of the most covered, one of the most easiest to get information on. So this is Jani Schofield. She was 7 when she was diagnosed with one of the most severe cases of childhood schizophrenia. So her specific hallucinations, they take the form of, imaginary children and animals, which, again, with many of her symptoms were confused with imaginative play. So it is quite difficult for clinicians to diagnose this, as it's hard to tell. But she, in fact, had hundreds of these imaginary friends, animals, with all different unique names and stuff like that. So, her parents knew something was wrong after her hallucinations started to turn violent. She would harm herself or others, claiming that those animals told her to do it. Again, the hallucinations, delusions. She even once tried to jump out her bedroom window, which I could not find how high. I was trying to see if it was like a ground floor, or if it was something, higher up. It did not say, but either way, that is something that is very, scary for a parent to go through with their child. And I even was reading that they ended up having to get 2 separate apartments, one for her younger brother and one for her, as he was in danger with her, her impulses that were hard to control. And so one parent would stay with one child, and then they would switch every night, which was, it's pretty sad and unfortunate, but I think they would much rather have their peace of mind that their other child is going to be safe. And again, there is no cure for this disorder, but they control her symptoms with heavy doses of medication, unfortunately, which is a lot for a parent to have to put their child through for their, for them to live a somewhat healthy life. This is something that affects them severely, so it's not just going to be they take meds and they're just going to be fixed. And then again, I put in here that this is just one specific case, and it's not all schizophrenics. Not all of them are going to be violent. Not all of them are going to be, quite like this, harmful to themselves or to others. So yeah, and then that was the end of that. These are the sources. The top one is the video that we watched in class for that case study. And there's another one just of the challenging of diagnosing this. And then I have the third one is going to be the slide where it had the number statistics of the types of hallucinations. And then the bottom one is going to be the impact on families slide. And so I am going to put a few review questions in the description box that I just wanted everyone to answer, just to, show that they understood a little bit of what was going on in this presentation. So the first one is going to be, what is the difference between positive and negative symptoms? And then the second one is going to be, what treatment did they end up using for Jani Schofield's case? And then the last one is just going to be, what is one struggle with diagnosing childhood onset schizophrenia? So thank you for watching.